So biomarkers they're really just substances in the body, and what they do is the the presence of them or absence of them in some cases indicate whether there is either a disease present or something about someone's disease has changed. So we can use biomarkers to monitor disease conditions, tell us that they're present, or especially relevant to precision medicine, of course, is, for example, where the presence of a particular biomarker may indicate that there's a particular targeted therapy that whatever condition it is that someone has may respond to. And so it gives treatment options to our physicians. And so that's why it's so important to one, know what they are, know why we're looking for it, and to be able to detect it with high levels of confidence. And that's a lot of the work that we do in pathology as pathologists. That's the reason why that question, testing for biomarkers, isn't as straightforward. I mean, biomarkers in general is not straightforward, but testing for them isn't necessarily as straightforward either because it does depend on what the biomarker actually is. And by that, I mean, I think initially I had said that it's a substance, right? And that's a very loose and broad term. And depending on the nature of that substance, you would test for it differently. And so that's why it's not necessarily as straightforward without some explanation around what those substances, those biological substances and molecules are for a particular biomarker, and hence how to detect them, because you would use different techniques to look for different substances or to demonstrate them, to detect them, and such. And of course, sometimes it also depends not only on the substance, but also on the abnormality in that substance that you're looking for. So we can certainly talk more about it, but it's more than a little bit of a sound bite. So DNA is actually it's a substance in our body, of course, and we all have unique DNA. DNA is it's the it's the instructions, the blueprint to making, for example, if it were possible technologically, a factory reset version of each of us. So we each have unique DNA, um, at least most of us, except for your identical twin. And that is the information that can create, or that did create you, and if need be and if possible again can create, as I said, the factory reset version of you. And much like other things that hold information or blueprint or like a book, like for example, if like in Morse code, right? Those are series of dashes and dots. And the order that they come in allows you to decipher whatever message is sort of encoded in there, right? Similar to how computers work. They work in a series of zeros and ones, and the order that that gets put in essentially can hold a whole lot of information, right? And actually, one of the most sophisticated systems that I can think of is, of course, our language, right? If we're talking about English, there are 26 letters that when you put them in particular orders and such, they hold a lot of information that can be used to do all sorts of things. So that's our DNA is very similar, except that in our DNA, instead of dashes and dots like in Morse code, or zeros and one like in computer code, or letters like the English language. We in DNA, what gets used, it's a series of four nucleotides that we use letters to represent, and they're A, T, C, and G. So all of our DNA is just repeating or different sequences of A, T, C, and G. So with that, that is enough to encode all of the diversity that, I mean, that we see in this world in human beings and such, actually in all organisms, right? And what sequencing is, it's a laboratory technique that allows us to determine what order in say your particular DNA, what order that those A, T, C, and G, um, what we call nitrogenous bases, occur in. And it's different for all of us. When we're talking about, so there's different techniques to determine that order that falls under the description of sequencing. Next generation sequencing is just, it's I guess sequencing on steroids. Whereas before you could sequencing took a long time because we have lots and lots of DNA, so lots and lots of bases, and their order to read through, and such. Next generation sequencing represents a technological advance that allows, scientists and physicians to sequence DNA, a lot of it, in a much shorter time. And so it really ramps up efficiency and our ability to get DNA sequence information much faster.